Good afternoon to every one of you. So I'd like to thank Dr. Kaltra for having given me the opportunity to present about the documentation, surgical documentation protocols. I don't have any financial interest in any of the techniques or the products shown in the presentation. Teamwork, actually, surgical documentation, even though the surgeon is the one who is doing the surgery, much of the process is taken care of by the other persons who do the most of the work. So it's a real teamwork, so you really need a team consent for the document. The documentation is very, very important. It actually guides us for a good clinical practice. It sets a standard of patient care and it really ensures the patient safety and satisfaction and make the benchmark for the outcomes with which it can have a high quality surgery. Next, the protocol. What are the protocols written? All the protocols, so many are really highly recommended, some are recommended and one or two are suggested actually. Date, time, checklist, preoperative verification, serial number, surgeons, anesthesia, timeout procedures, findings on the table, steps of the surgeries, complications, management, pasting of the labels, diagrammatic documentation, video recording, record keeping and signature. I go one by one. First, it's a checklist system. Definitely, it's a most important part of any surgery or procedure. So it's a memory type of memory recall. Clarify the minimum expected steps in a complex process. As I told you, it involves so many persons, so you definitely have a best thing is to have a checklist. Establish a higher standard of baseline performance. Next, I show that is the protocol. Actually, checklist is in the hospital. Usually, initially that dental disorders. Then preoperative name, actually you will be very careful about the name. Actually 2-3 patients with the same name is very, very careful. Then should have the IP number checked. Then IOL power calculation. Then the most important, as already the speakers established, is the identity consent. Informed consent is most important thing. And patient because nowadays they expect most of the surgeries most of the surgeries we do with the patient's fitness only. Next one is the preoperative verification of the sterilization, whatever that autoclave. You have to check, even the staff if the staff also checks, but better you check the labels from the autoclave, each individual being instrument set also. Then infusion fluids, whatever the fluid you are using. Anesthetics, suppose the topical anesthesia or infiltrative anesthesia, and the injection, what are the injections you are going to give on the table. Additional viscoelastic substances or the devices, suppose you have got subluxation lens, it's better to have the hooks or the dilators. Then date and time of surgery is very, very important. It's a very most important thing. Then time. Time is actually you are supposed to mention the starting time as well as the completions. Next, suppose if your serial number, this comes because suppose if you are doing more than one surgery, it is suppose you can even usually in our hospital we always ask the sister to write the number of the patients. Suppose the third number, suppose the OT1, suppose patient serial number is 3 or 4, then the patient checking, then she usually signs on the infusion bottle. Then case sheets, that you should mention in the case sheet also what is the number of the serial number of the patient on that day, particular day on the particular theatre. Operation is also it should mention, especially if you get a cluster infections, it really helps a lot. Then surgeon, assistant surgeon and the staff and anesthetist should have everything, the name should be clear. Then suppose you are using the local anesthetics, whether it's a local with IV sedation and general. Suppose in case you are using a general anesthesia, the vital parameters at the time of surgery or at the end of surgery should be clearly mentioned in the case sheet. Batch, expiry date and physical verification are the fluids, especially the infusion fluids, whether it's a ringer lactate or the VSS, the sister should verify physical verification and then expiry date. These things usually written in a register called Consumable, this is registers. Then timeout procedure. This is one of the very, very important step in the surgical documentation. It's a final verification. Just 1 minute before doing the surgeries, the surgeon, verbally surgeons or the doctors actually, and the anesthetist and the other paramedical verbally confirm the identity of the patient and the eye to be operated and procedure of the surgery. As soon as they can make other things, especially IOL Power means suppose it's a well pitch IOL, whether it's IOL standard IOL or a foldable, monofocal, or any other specific IOL, suppose if you have a coated one, suppose the patient has got injury, something else, all these things is better to be documented. Then findings on the table, suppose you might have seen on the silk lamp and you might have thought everything is okay, but you may not have seen certain things at the time of time examination. Suppose deep set eyes, then you have to arrange the table or arrange the chair and then you have to put it on the temporal side. So that you can even mention that. And congestion, sometimes you may not have seen that congestion after putting topicals or after giving the injection, you may know. corneal opacity, very fine opacity, CDKs you may not be able to see. Only on the microscope magnification you may be able to see. Then that also you have to modify your technique on the incision. Signs of previous surgery, some that occurs, I think each surgeon will have noticed. Some patient may not have told anything, suddenly you may have seen a limbal scar or a pars panartectomy scars. A pseudo-exfoliation, this also, if it is marked, you can definitely see. If it is a mild, subtle, you may be able to see only after dilatation on the table. Sometimes even you can see after the staining. Sometimes it will be visible only after staining. Then pigments on the anterior lens capsule show the old case of uveitis and subcutaneous lenses. Even most of the surgeons will agree in the left at least 1 or 2 cases on the table only they will recognize on the table, or only doing the anterior capsular axis only they will recognize that. Something is moving, then only they will recognize. That also you can immediately document. Then poor mydriasis. Patient might have seen in the OP time, you may not have time. So the patient will just stare at see the fundus. So you may not have seen about the mydriasis. Only on the table you would have seen the mydriasis poor. And then you can mention that. Then steps of the surgery should standard format. Suppose any alterations, it's always better to document it in the. Then complications, name of the complication, whatever the complication, then at what stage you got the complication, and what is the probable cause. Whatever you think you better write it, minor or major, and management. How do you manage? Actually, it's accurate documentation, especially diagrammatic documentation, very important if you have got a complication. Suppose you are not mentioned, suppose somebody comes out later with that, then they may think that you are poorly diagnosed. That poorly diagnosed means naturally poor management also. That turns upon our management. So management of complication also always try to follow the standard textbook norms or accept a standard practice, standard surgical practice, whatever it is that you can document. Suppose in case during the surgery, suppose you have got a opinion or second consultation from your senior through phone, that also you can make. You can tell the second consultant, and you can document that consultation. Even the phone consultation, you can document in the pay sheet. Diagrammatic documentation is very, very important, especially when you have altered the standard format or if there is a complication. Especially in the trauma cases, mostly you may be able to see the real nature of the trauma, real nature of the injury only on the table. Those things you have to do a diagrammatic documentation. So video recording, if it is there, it's very good. As I said, everything is not a perfect recommended. So if it is there, it is very good. It's better to save it, and you can give it in a CD format if you are willing to the patient also. Signatures, as I told you, it's a teamwork. So all the surgeon, anesthetic staff nurse, they should write it they should sign in the case sheet, and they should write it in the operation. They have to register also. The record keeping, as I said, that's very, very important. Whatever the autoclave logbook, whatever the labels you have got for the autoclaves, from the bin and things, then operation register, the name, patient name, surgery, whatever things, and consumable register. I have told you infusion fluids, injections, and whatever the things you have used. OT logbook. Then depends upon that whether it shows the temperature, humidity, the labels you have taken from that. Then complication register is a must, and you should write it, and what is the complication, minor, major, what are the steps taken, and you should sign it. Thank you so much.